Ever wondered what ambulatory anesthesia is and how it's prepared? Well, it's time to satisfy your curiosity. Ambulatory anesthesia, often also referred to as outpatient or same-day anesthesia, is a complex medical specialty that allows patients to undergo surgery and then return home on the same day. It's a crucial part of the medical field, enabling thousands of patients every day to undergo necessary procedures with minimal disruption to their daily lives. Now, why is ambulatory anesthesia so important, you ask? Well, it's pretty straightforward. It allows for the efficient delivery of essential surgical care, reduces hospital stay duration, and promotes quicker recovery. With the advent of new anesthetic drugs and techniques, an increasing number of surgical procedures are now being performed on an outpatient basis. But ambulatory anesthesia is not just about the anesthesia itself. It's about a comprehensive approach to patient care that begins long before the surgery starts and continues well after it's over. This includes a detailed preoperative assessment, meticulous intraoperative management, and careful postoperative follow-up. The purpose of this video is to provide an in-depth understanding of ambulatory anesthesia. We'll be walking through several key aspects of this process, including preoperative preparation, preoperative medications, prophylactic antibiotics, the preparation for anesthesia, equipment and monitoring, and airway management. Each of these components plays a vital role in ensuring the safety and comfort of patients undergoing surgery. It's important to remember that each patient is unique, and the approach to ambulatory anesthesia must be tailored to the individual's specific needs and circumstances. So, while we'll be providing a broad overview, always remember the importance of individualized patient care. So, are you ready to delve into the fascinating world of ambulatory anesthesia? Whether you're a seasoned healthcare professional looking to brush up on your knowledge or a curious onlooker, there's something here for everyone. Now that we have a grasp on what ambulatory anesthesia is, let's delve deeper into its preparation. Preparation is key, isn't it? The same applies to ambulatory anesthesia. It's a process that begins well before the patient steps into the operating room. The preoperative phase is crucial in ensuring that the anesthesia is administered safely and effectively. First, let's talk about preoperative instructions. It's important that the patient understands what is expected of them. This includes understanding the procedure, potential risks, and the postoperative recovery plan. It's essential that they feel comfortable and confident going into the operation. Next up, fasting instructions. In general, patients are advised not to eat or drink for a certain period before the operation. This is typically around 6 hours for food and 2 hours for clear liquids. This reduces the risk of aspiration during anesthesia. Now, onto the use of current medications. It's crucial to evaluate the patient's medication regimen, as some drugs may interact with the anesthesia. Depending on the medication, it may need to be continued, adjusted, or stopped before the operation. As for the day before the operation, it's all about rest and hydration. The patient should avoid alcohol, get a good night's sleep, and drink plenty of water, unless otherwise instructed by their doctor. Finally, we arrive at the day of the operation. The pre-anesthetic evaluation involves a thorough review of the patient's medical history, physical examination, and any necessary lab tests. This helps to identify any potential issues that could affect the anesthesia process. It's important to remember that every patient is unique, and so is their anesthetic plan. The preoperative preparation is tailored to each individual, taking into account their health status, the type of surgery, and their personal preferences. Preparation is an essential step, but it's not the only one. Let's move on to preoperative medications. This is where we delve into the specifics of what medications may be given before anesthesia to enhance its effect and minimize potential side effects. But that's a topic for our next scene. Medications are a fundamental part of ambulatory anesthesia. Let's explore this aspect. A key part of ensuring an individual's comfort and safety during a procedure is the administration of preoperative medications. These are a variety of drugs given before anesthesia to enhance its efficacy and minimize potential side effects. One of the primary types of preoperative medications is anti-anxiety premedicants. These medications, like benzodiazepines, are used to reduce anxiety and help patients relax before their procedure. They can also assist in creating a sense of calm and relaxation, making the entire process smoother and less stressful. Next, we have sedative, amnesic, and analgesic premedicants. These drugs not only help to sedate the patient, but also work to prevent the formation of traumatic memories associated with the surgery. Analgesic medications are used to manage pain, a critical aspect of patient comfort. To prevent acid aspiration, a common risk during anesthesia, certain medications are administered. These drugs, such as proton pump inhibitors or H2 blockers, decrease the production of stomach acid, reducing the risk of aspiration and subsequent complications. Nausea and vomiting can be common side effects post-surgery, which is where antiemetic premedicants and prophylaxis come into play. These medications help prevent these symptoms, improving the patient's postoperative experience. Lastly, we have miscellaneous premedicants. These could be anything from medications to manage chronic conditions to drugs that help minimize specific surgical risks. These are tailored to the individual patient's needs and can vary greatly. It's crucial to remember that the goal of each of these medications is to ensure the patient's comfort and safety. They work together with the anesthesia to provide a smooth surgical experience, minimizing discomfort and potential complications. Preoperative medications are a complex yet integral component of ambulatory anesthesia. Understanding their roles and functions is key to understanding how we can make a patient's surgical journey as comfortable and safe as possible. After understanding the role of medications, we can now discuss prophylactic antibiotics. In this segment, we'll discuss the role of prophylactic antibiotics in ambulatory anesthesia. Prophylactic antibiotics, simply put, are medications given as a preventative measure to guard against potential infections during and after surgery. They are a crucial part of the surgical process, especially in ambulatory or outpatient procedures where the patient is expected to return home shortly after the operation. These antibiotics are administered before the operation begins, usually within 1 hour of the surgical incision. The goal here is to ensure that these powerful drugs are in the patient's system, ready to combat any bacteria that may enter during surgery. The choice of antibiotic often depends on the type of surgery being performed and the most common bacteria associated with that procedure. It's like a targeted strike against potential invaders. This targeted approach helps to reduce the risk of surgical site infections, a major complication that can lead to extended hospital stays or even readmission. With antibiotics covered, we are now ready to move on to the preparation for anesthesia. The stage is set, and we're ready for the main event, the anesthesia. As we delve into the world of anesthesia, we must first understand the gravity of preparation. Preparation for anesthesia is not a one-size-fits-all process. It's a bespoke strategy, tailored to each patient's unique needs and medical history. Let's start with the general preparation. This phase encompasses a thorough assessment of the patient's overall health, focusing on any existing medical conditions, allergies, or previous reactions to anesthesia. The goal here is to anticipate and mitigate any potential risks or complications. Next, we move on to intravenous access, a critical part of the process. This is where we introduce a catheter into a vein, providing a direct route for anesthetic drugs to enter the bloodstream. A common concern during this phase is the discomfort associated with needle insertion. But worry not. We have a secret weapon, cream, a topical anesthetic that numbs the skin and makes the process a whole lot more bearable. Now let's talk about the anesthetic plan. This is where the anesthesiologist maps out the type of anesthesia, the drugs to be used, and the method of administration. The plan is designed to ensure maximum safety and comfort for the patient. It also considers the duration and type of surgery, as well as the patient's position during the procedure. In general, anesthetic plans can be divided into two main categories: general anesthesia, where the patient is unconscious, and regional or local anesthesia, where only a specific part of the body is numbed. The choice between the two depends on several factors, including the patient's health, the nature of the surgery, and the surgeon's preference. In the end, the goal of all this preparation is to ensure a safe and smooth anesthesia experience. Remember, every step in this process is meticulously planned and executed with the utmost attention to detail and patient safety. Preparation for anesthesia done, let's talk about the equipment and monitoring required. No procedure is complete without the right equipment and monitoring. Let's dive into this topic. The equipment used in ambulatory anesthesia is as varied as the procedures that require its use. At the heart of it all is the anesthetic machine. This essential device mixes gases and delivers them to the patient, ensuring a controlled state of unconsciousness. It's a complex piece of machinery that requires a deep understanding to operate properly. Next, we have the airway equipment. This includes laryngoscopes and endotracheal tubes, which help ensure a clear path for breathing during the procedure. Laryngoscopes are used to view the larynx, while endotracheal tubes are inserted into the trachea to maintain an open airway. Then there's the intravenous equipment. This includes needles, syringes, and IV lines, all of which are vital for delivering medications and fluids directly into the patient's bloodstream. But equipment is just half the story. Monitoring is the other crucial part of the equation. Without proper monitoring, even the most advanced equipment can't guarantee a safe and successful procedure. First and foremost, we have the pulse oximeter. This small but powerful device measures the level of oxygen in the patient's blood, alerting the anesthesiologist to any potential issues with oxygenation. Then, there's the electrocardiogram, or ECG, which constantly monitors the heart's activity. It's essential for detecting any irregularities or abnormalities in the heart's rhythm. Blood pressure monitoring is also key. Using a cuff and monitor, the anesthesiologist can keep track of the patient's blood pressure throughout the procedure, making adjustments as necessary to maintain optimal levels. And let's not forget about capnography, which measures the concentration of carbon dioxide in the patient's exhaled air. This can provide valuable information about the patient's respiratory status and the effectiveness of ventilation. All these pieces of equipment and monitoring systems work together to ensure the patient's safety and comfort during the procedure. They allow anesthesiologists to control and adjust the anesthesia as needed, responding to the patient's individual needs in real time. Now that we've covered equipment and monitoring, let's discuss airway management. Airway management is a critical part of ambulatory anesthesia. Let's get into it. In the world of ambulatory anesthesia, an anesthesiologist's toolkit isn't complete without the face mask, a simple yet effective device. This mask fits over the patient's nose and mouth, creating a seal to deliver oxygen and anesthetic gases. It's the go-to for many procedures, especially those of shorter duration. But remember, it's not just about slapping on the mask. Proper positioning and a gentle yet firm grip are key to successful face mask ventilation. Now, let's talk about tracheal intubation. Picture this: a flexible plastic tube inserted into the windpipe through the mouth or nose. Intimidating, maybe? Necessary, absolutely. This tube safeguards the patient's airway, ensuring unobstructed breathing and protecting the lungs from aspiration. It's often used in longer procedures or when the patient's airway might be compromised. Tracheal intubation is a skill that requires practice and precision, but it's an invaluable part of the anesthesiologist's arsenal. But what if the face mask isn't enough, and tracheal intubation seems excessive? Enter the laryngeal mask airway, or LMA. Picture a softer, more flexible version of the tracheal tube, designed to sit above the opening to the windpipe, rather than inside it. The LMA is a versatile tool, ideal for procedures where the patient can breathe spontaneously, but may still require airway protection. It's like the Goldilocks of airway management, just right for those in-between cases. In airway management, one size certainly does not fit all. Whether it's the simplicity of a face mask, the security of tracheal intubation, or the versatility of an LMA, each tool has its place. An effective anesthesiologist knows how to select the right tool for the job, factoring in the patient's needs, the nature of the procedure, and their own expertise. That brings us to the end of our exploration of ambulatory anesthesia. We hope this video has been informative and helpful. We've covered a lot of ground today in our exploration of ambulatory anesthesia. Let's take a moment to recap and solidify the key points we've discussed. We started with an introduction to ambulatory anesthesia, painting a picture of its importance and role in the medical field. We delved into the concept of preoperative preparation, highlighting the significance of preoperative instructions, fasting guidelines, and the handling of current medications. We also stressed the importance of the day before the operation and the pre-anesthetic evaluation on the day of the operation. Next, we dove into the world of preoperative medications. We discussed the role and impact of anti-anxiety premedicants, sedative, amnesic, and analgesic premedicants. We also touched on medications to prevent acid aspiration, antiemetic premedicants and prophylaxis, and other miscellaneous premedicants. Moving on, we explored the crucial topic of prophylactic antibiotics, focusing on their role in preventing postoperative infections. Then we transitioned into the preparation for anesthesia, discussing general preparation, intravenous access and EMLA cream, and the process of crafting an anesthetic plan. Our journey continued with a deep dive into the equipment and monitoring used during ambulatory anesthesia, emphasizing the importance of proper equipment usage and careful, continuous monitoring of the patient's vital signs. Finally, we ventured into the realm of airway management, where we discussed the use of face masks, tracheal intubation, and the laryngeal mask airway. Throughout this exploration, we've seen the intricate dance that is ambulatory anesthesia, a blend of careful preparation, meticulous execution, and constant vigilance. It's a field that requires unwavering attention, a deep understanding of the human body, and a commitment to patient safety and comfort. Thank you for joining us on this journey through ambulatory anesthesia. Remember, this is just the tip of the iceberg. The world of anesthesia is vast and ever-expanding, and there's always more to learn. So keep exploring, keep asking questions, and keep expanding your knowledge. See you in our next video.